Welcome, Dr. Mandel. I want to show you a fantastic technique to instantaneously reduce muscle contracture and regain motion in the joints. We're going to focus on increasing mobility in the facet joints. These are the facet joints of the cervical spine. The vertebrae sit on top of each other and they sit on these facet joints throughout the entire vertebrae, throughout the entire spine. So if these facet joints are lacking motion, you're going to lack function, and therefore the muscles are going to contract, the nerves are going to become inflamed and irritated, and you're going to have a gambit of different symptoms, anywhere from decreased motion to neck spasming to pain underneath the skull. Those nerves then can affect into the head, the eyes, the ears, the arms, the chest, as well between the shoulder blades. So the most important thing is to increase mobility, and that's what we're going to do today. Now, the purpose of the facet joints is to stabilize the weight of the body or of the vertebrae. Obviously, the heavier weight, the thicker or bigger facet joints there are, particularly in the lower back, and the smaller or thinner facet joints in the neck, because in the neck, we're stabilizing the head being about 12 pounds. Now, imagine if you spend all your time looking down like this all day long, forward head posture, which is a major epidemic. These facet joints are going to start to have problems. Now, what happens is these facet joints can start to lock or adhese. The muscles around it will start to contract. When they contract, they start to shorten, pulling on one end as compared to the other. They get shorter. So now we're trying to move our neck, trying to do our normal things, and we get more inflammation because of the dysfunction that's present. So what we're going to do is that we're going to stretch the muscles, reduce adhesions and scar tissue that's potentially in those facet joints, and we're going to regain mobility immediately. That's what it's all about. I want you to see changes like immediately. And by doing this, you're not only going to feel better, but you're going to preserve your body. Now remember, when there are fixations or locking within a joint, the areas above and below have to start moving more. Now, if you notice, everything that we do, flexing, extending, left and right lateral flexion, rotating left and right, all are moving on these facet joints. So if you have a facet joint or an area in there, which is very common, and it's not moving, that means the body is trying to compensate to move more above and below. What's important is that when people get disc surgery, what's happening is that you have an area within the joint that's locked. It's not moving. Two vertebrae are locked together. So there's no movement in that facet joint, totally fused. So what happens is the body tries to find ways to get more movement in the spine, and by doing that, the body starts increasing more movement above and below the joint. That's why those joints wear out quicker, and you start eventually having problems there later. So to get our landmark, these are the spinous processes. These are the bones that stick out behind our spine. So when we reach around on the same side, if it's our right side, and we reach around with the right hand, we're going to contact the lower part of the neck first, because we're going to work our way up, but start in the lower part of the neck, find the spinous processes, come off of about a ½ inch, and you're going to take these fingers, if it's 3 fingers or 4 fingers, whatever you're comfortable with, you'll be right over those facet joints. Dig your fingers in there deep and hold it there. You'll take the other hand, and what we'll do is we'll stretch it this way as we're holding it. So we're elongating the muscle because we're putting tension on the tendon, and we're opening up the adhesions or fixations or lack of movement that's occurring in the facet joint, and we're regaining mobility and function. So let me be the demo. I notice when I turn my head to the left, I feel pulling and locking on the right side. It's limiting my range of motion. When I limit my range of motion, I can feel the muscles actually tugging up behind my skull, which obviously can cause other symptoms. I'm going to take these couple of fingers on my same side, my right hand, and I'm just going to feel for the spinous process right here. I'm going to come off about a ½ inch, and I'm going to grab it nice and tight as I push in there, and I hold it there, nice and firm. Hold it in, nice and deep. I'm going to take the opposite hand, which is my left hand. I'm going to pull my head over to the left side, and as I pull my head over, I'm going to feel that nice burning stretch of that muscle. Then I can pull down forward to the left. I'll feel that nice burning stretch, and what we're doing is we're stretching the tendon, the muscle, and we're actually opening up the facet joint to regain motion and function. Remember, more increased motion, more increased function, better health. When we have this increased mobility, we're increasing the blood supply, the nutrients to the joint. We're preventing degenerative problems and arthritic changes. So you can do this at multiple areas in your neck. You can work your way up the neck like this and work your way up as you hold those facet joints. Okay? You can do both sides or you can do either side. You're gonna be the boss here. You're gonna know what works best for you, but if you do the technique right, you're going to get great, fast results. I ask you to share this video on your social media. Check me out, Motivational Doc on Facebook. Leave your comments below, please. You're gonna get thousands of people who are going to make other comments as well. Make it a great day. I'm Dr. Alan Mandel.